We are talking about diathermy or electrosurgical unit today. So, in diathermy, there is monopolar and there is bipolar. So, in monopolar, patient is a part of the circuit, but in bipolar, patient is not a part of the circuit. So, these two work differently. But diathermy itself is delivery of the high current in a focused area. It is safe, it is useful in increasing the speed of the surgery with safety, and also it is helpful in achieving hemostasis. It is helpful in dissecting the tissues wherever it is required. So, how do we use this diathermy and why it is effective on a body? So the diathermy units that we have currently in the market produces high radio frequency current, and this is targeted at the focused areas. So at 60 degrees, there will be evaporation and of the water and cell death will happen in the tissues. Between 60 and 99 degrees, there will be sealing effect which happens when there is vaporization or when there is the denaturation of the proteins that is in the blood vessels, where the walls of the blood vessels get sealed off, and this will cause coagulation. Above 100 degrees, there is a cutting effect. So in diathermy, there is coagulation and also there is cutting mode. And the newer generation diathermy units have these in a single button where it acts as a coagulation also, and it works as cutting also. So when we talk about the principles of electrosurgery, it is very important to know how we have to use our electrodiathermy machine. The bipolar diathermy that we speak about uses radio frequency electrical current to cut and coagulate the tissue. So here in cutting mode, there is a continuous delivery of the current at low voltage. This cuts the tissues through and through, but there is no much hemostasis in this mode. When we talk about coagulation, there is intermittent delivery of the low voltage current, which helps in sealing off of the tissues by the denaturation of the proteins in the collagen and elastin part of the vessels. So here the newer the advances is the bipolar shearer. So the instrument of bipolar shearer has a certain principles where one, there is a energy delivery system where the energy is delivered to a specific current to the tissue, and it will cause both coagulation and cutting without using extra instruments. So the shearer also has an advantage where there is a feedback system in this electrosurgical device where the tissues, how the tissue responds depending on the usage of the current by the shearer will start adjusting the delivery of the current. So this keeps the shearer effective, and also it keeps it safe at the same time to be used even in a area where there is vascularity, where there are crucial steps which can be involved, where there are important structures which are there. The bipolar shearer that is available now by various companies, they have the advantage of one, sealing the blood vessels. So by giving uniform compression and specific delivery of the electric current, it seals the blood vessels anywhere between 5 mm to 7 mm without actually causing any much problem of bleeding. Second, it helps in dissection. So the sealing of the blood vessels helps in cases where we do hysterectomies, myomectomies, and the dissection helps in terms of where there are very important structures like in retroperitoneal space, when we do surgeries for gyne-oncological cases, and also in endometriosis surgery. So this also gives us the precision and speed, because we are not waiting for the suture to be taken, or we are not waiting for different instruments to be used. And this will reduce the operating time, this will reduce the anesthesia time, this will reduce the blood loss, and this will improve the patient's recovery. Also, in all this, there is a benefit of other advantage is that there is no foreign objects. So, like clips, vascular clips, or ligatures, or anything. So, this is just the usage of the current at the right amount, with the right speed, to the right tissues. So, here this will prevent the body's reaction to any kind of foreign body. So this shearer and also the electrosurgical units are available in the market from various companies like Allen, Cordra, then there is PB India, Shalya. So all of these, the basis remains almost the same. The principles remain almost the same. The handheld instruments like the shearer for laparoscopy and for open surgeries, the concept remains the same. There will be slight modifications depending on each company as to how the blade, the tip of the blade is going to be. So some have sharp tips, some have blunt tips. So it depends on our the comfort of using it and how familiar we are using in such things. So this we can again take a demo and figure out what works for us. So coming to the usage safety, so these instruments require some kind of training. At least we need to do about 10 cases to get familiar with how much pressure we need to apply, and how much time we need to press the foot pedal to deliver the energy for the tissue to coagulate, for the tissue to cut, and for dissection purpose also how we have to use these instruments. It has a learning curve, and if it is used properly, these are one of the safest and one of the assets that we can use now in surgical aspects of our career, of our profession. But if it is not used properly, the complication could be, there could be burns, there could be inadvertent bleeding, which will take time and also more effort to control it if the vessels get retracted. And these have to be handled by a professional who knows as to how to deal with these kind of problems. In electrosurgical diathermy devices, tissue impedance plays a crucial role in energy delivery. The impedance and energy delivery, where the tissue, when the electric current or radio frequency current is applied, there will be a resistance from the tissue. So this is called as impedance, and this keeps changing depending on the tissues, depending on the patient's profile, and also depending on the current that is already passing through the tissues. So the impedance feedback is something where the tissues will give a feedback to the machine, and the machine catches it, and as the tissue changes, like from heating to moisture loss to coagulation, its impedance also changes. So the device can continuously measure this change in the impedance, and there is energy adjustment. So depending on the feedback of the impedance that is being sent from the tissues, the machine tries to adjust the energy delivery in real time. As in, when the tissue impedance reaches a certain level, it indicates that the tissue has been adequately sealed, and at this point, the device automatically stops delivering the energy. So this helps in safety and efficacy of the instrument. So this feedback mechanism helps us in delivering the right amount of energy to the tissue without actually causing unnecessary damage or charring, but it is enough to effectively seal the tissue and also to cut the tissue. So this is a great advantage in the bipolar the diathermy devices, where there is a constant dialogue or constant the communication between the device and the tissue. And some devices like Allen have a beep system where it starts beeping once the vessel is coagulated completely, and there will be no energy which is delivered after this beep.